All right, Bob, am I on? All right. Hey, good afternoon, everybody. This is Elizabeth Adriano coming to you from Naval Information Forces, headquarters over here in Suffolk. I'm really happy that you all have made the decision to dial in today. Thank you so much for joining me. For those of you who have dialed in who don't know either much about me or who I am, I'm just going to take a moment to introduce myself. I'm an OBGYN by trade, so for most of my career, my job has been taking care of women, and it's something that I very much have enjoyed doing. And to kind of transition over to Information Forces has been an amazing opportunity, and I'm really happy to be able to be here and extending to you all, hopefully the liaison and the care that you need and that you desire. As we've stumbled through this COVID and gotten a little bit better at planning and reacting, as I mentioned in my video, there have been a lot of questions that have come across my desk. I've been getting a lot of phone calls, both from within the command, within the region, and then worldwide. And so I wanted to take this opportunity to spend some time with you all so that I can answer questions that you may have that you either haven't emailed me or are kind of fuzzy on, or you've seen conflicting information maybe from different agencies or reported in the press. And so what I promise you is that I will address things that I know, and things that I don't know, I will make a commitment to get back to you on. And my plan is to spend about an hour with you today. So at about 1400, we'll call it quits. And I plan on offering another town hall, if you all would like one, sometime within the next week or so, that will be scheduled at a later time so that I can address folks who are unable to dial in today. So with that, if you have questions, please begin texting them in or sending them in via the Facebook app so that I can know what questions are out there and I can go ahead and start answering them for you. You guys have anything yet? Okay, great. So before we get started and for real and see if you guys have questions for me, for those of you who haven't had the opportunity to watch the video, I'm not going to go over all the topics that I already discussed, but they included cleaning and disinfecting. They included some clarification on definitions that are being used right now. So what is a person or patient under investigation? What does it mean to be either isolated or on restriction of movement? What are we doing right now for testing? What are the differences in testing as far as when results are able to come back to commands regarding whether their sailors are positive and negative? Why are some sailors getting tested and others are not, but they're being treated kind of the same way, with a little bit of a difference when it comes to the return to work policy? So those are some of the things that I addressed in the video. The other thing that I talked about towards the end, but not because it had any less importance, was just mental health and stress. And as we continue to move forward and we begin to see this escalation in sickness across the United States, and we are working on flattening that curve, you're more than likely to begin to know somebody that you either know in your neighborhood or you know that you work with that becomes COVID positive. And what does that mean for you? And how does that affect the overall stress level? It's really hard to stay in your house and not go out very often, even if you love your family, right? It's hard to be kind of stuck in your neighborhood. It's hard to feel like when you go to the store, maybe there aren't all the things there that you're used to having. And so that begins to cause more and more stress. And then most of us are proud of the work that we do, and we like to be in the workspace accomplishing those tasks every day, and to be doing those from home, even when you are healthy and could otherwise be at work, is imposed as a sort of isolation as well, social isolation. And even though we've gotten really awesome at Facebooking and WhatsApping and Google Duo and all of these ways to communicate with each other, it's still not quite the same as being in a room with somebody, right? So it's been very challenging for folks. The entire way that we live our lives has been disrupted based on COVID. The way we do work, the way we shop, the way that we conduct schooling, both for small children and then our college-age kids. And so that's been also very challenging. So what can you do to help with maintaining your health and wellness and then kind of shoring yourself up and keeping yourself strong so that you don't succumb to anxiety, irritability, depression from the stress that's ongoing? And as I mentioned in the video, it would be really helpful for all of us to at least make sure we're taking care of our normal health providing activities. So eating healthfully, making sure you're hydrating, making sure you're exercising as appropriate. Get outside, enjoy nature, do a little vitamin D conversion with access to sunlight, exposure to sunlight. Those are some things that you can do. Make a conscious effort to express gratitude and to be thankful for the things that you do have that are positive in your life, instead of focusing maybe on some of the negatives. There certainly are plenty of negative things you could choose to focus on. But if you take the time to express gratitude and to focus on the positive, that goes a long way toward maintaining mental health and wellness and to shoring you up against those other things. We have a lot of resources as well that you have access to. Fleet and Family Services, I'm going to give them a shout out right now. They have licensed clinical social workers and counselors that are standing by to just be a sounding board if you feel like you need one. We also, of course, have mental health resources in addition. And I'm getting a cue that I may have a question that's come through. So I'm going to stop just for a moment and see what the next question is.
Okay, so Charlene asked, she said the guidance on the use of masks is confusing. Can you cover that? Should we use one if we go to a store?
That's a great question, and it's confusing partly because the message has changed almost 180 degrees, right, from when we first kind of started all this. So at the beginning of the knowledge of COVID and the fact that it was beginning to spread and we were trying to figure out how we were going to protect ourselves and each other, the initial guidance was it doesn't do really any good to wear a mask, partly because of the masks that were out there and the size of the holes in that mask converse to the size of the holes, not the size of the holes, the size of viral particles. And so when you have tiny little viral particles that are smaller than the holes in a mask, they can get through. Not only that, but at the outset, there was such a surge to go get these masks for people that thought they were going to be very helpful, that put a shortage in the market on masks that were then available for healthcare workers. So some of this is what I would call a numbers game. For healthcare workers, it's absolutely critical that they be able to wear masks when working with sick people, and part of that is because of the sheer volume of the virus that they're exposed to. Whereas for the rest of us, at least at the beginning, before we knew how this was spreading and the extent that it was going to spread, the chances that you were going to come into contact with somebody out and about, or that you yourself were going to be sick and need to protect others, was relatively low. We're learning a lot more about how this virus spreads, and there seems to be, and we don't know the exact percentage or the number of people that are out among us who have probably already been exposed, they've been infected, their body has converted to antibodies, their immune system is functioning and well, so they have developed antibodies and an immunity to the disease, and they never ever had a symptom. So they have no idea that at some point they're exhibiting what's called asymptomatic shedding or asymptomatic spread. And so as this COVID disease has become much more prevalent throughout the population, the recommendations have changed. And so now we are recommending that if you are unable to maintain 6 feet of distance between you and the guy next to you or the lady next to you, you should probably have a mask on, and that's again for prolonged contact. So your question about whether you should wear one when you go to the store, I think for right now the answer is probably yes if you cannot maintain 6 feet of distance consistently between you and the shopper pushing a cart next to you. Does that make sense? Okay.
Okay, we have another question from Jackie. Says, I heard that warm or hot water or liquid consumption was recommended even over cold water. Can you clarify?
So I am not aware of any medical evidence that says warm water or cold water is better or worse for you in either combating the virus or for any other health reason. Obviously, if you're drinking hot tea because you have a sore throat, that's symptomatically because it makes you feel better. But there's no medical evidence that I'm aware of that the temperature of the water that you're drinking will have any effect, either positive or negative, on how your body either combats the virus, fights the virus, or shores up its own immunity. It's usually personal preference, right? Some people like to have a nice glass of cold water, especially if they're exercising, and other people don't care what temp it is.
Okay, we have one from Melissa. It says, what type of advice do you have for sailors who are coming back from operations and haven't had the chance to get used to any of the new normal? My spouse and many others have been underway since this started, before this started getting serious, and I'm interested if there's any ideas to make it easier.
That's a great question. And, you know, as folks up here at headquarters have been talking about we are living in a completely new normal, and one that probably nobody could see, either could see coming or could envision. It's almost like this dystopian society, right? So I think that the best that we can do for our men and women that are coming back from a deployment, whether it's a short deployment or a long deployment, if they haven't kind of been living the reality that we're all living here, is just to help them ease into it and encourage them to wear the face mask when they go out in public if they can't maintain 6 feet. Remind them when they are maybe not washing their hands before or after preparing food that it's really important for them to do so. Remind them that even though we touch our faces a lot, I think I caught myself doing it at the beginning of this live feed, that we need to consciously remind ourselves and others to stop touching our faces, because that's one of the big ways that this virus spreads. It is in respiratory droplets, but it's also on surfaces. And so whenever we touch surfaces and then touch our faces, we are unconsciously, for the most part, encouraging the spread of the virus. And then also, just, when you see your loved one coming home getting frustrated, just reassure them you've already kind of gone through that frustration, and you are now in the acceptance phase of what we call the 5 steps of going through mourning or a loss, right? Because what we've lost is our normal way of life. So you've already gone through the anger phase, you've gone through the denial phase, you're in the acceptance phase, and your spouse or your loved one is going to take a while to get to that phase of the whole kind of mourning process, which is what we've all gone through. So just be as encouraging as you can. Seek out resources, encourage them to contact family members via Skype, FaceTime, WhatsApp that may not be physically present, so that they can feel connected even when they're feeling disconnected from, their usual social interactions.
Okay, ma'am. Selby says, thank you for the town hall. My question is about antibody testing.
Mm-hmm.
Are there valid antibody tests that the Navy can conduct to identify who has already contracted the virus and is now immune and no longer contagious?
So that is a great question as well, and I'm going to stop saying that because all these are great questions. So the answer is yes, there are tests that can be done, and some of them are still in the development phase to make sure that they're actually accurate. And so the DoD is actively working on providing a test for folks that will do exactly that. You may have seen in the news that Miami-Dade County, in association with the University of Miami, has already begun doing that. It's called surveillance testing, and it's going to help Miami-Dade help them manage this from a community health standpoint. So the point of the antibody test is, you may or may not already know this, is to get a blood sample and to see whether you have either long-term or short-term antibodies that you have developed as evidence that you've already had an infection. Your body has rallied, has fought against it, and you now are immune. There's a short-term antibody that's formulated within, a certain number of days of you having been infected, and then your body eventually converts that to a longer-term antibody that provides you with a longer-term immunity. Sometimes it's lifetime, sometimes it's not, but it's definitely much longer term. And so I know that there are some tests in development right now. Interestingly, there's a test that's being developed looking at having you do at-home testing. So this company offers, and the DoD is not offering this right now, nor may they ever. So this is just something that I'm aware of, but that we might not be offering. Basically, you can order the test kit. It's delivered to you the next day. You get a blood sample, just a quick finger prick. That goes into the assay box, and then you take a picture, and it is then sent to your doctor's office, where they then will run it through their lab, and within a few hours you have a result. There are a lot of logistical challenges with making that available throughout the DoD, but there is more invasive blood testing where you would have to go to a lab and get your blood tested. That, again, over time is going to be really helpful in helping us to identify what is the true prevalence of the disease, so that for folks who maybe never had symptoms and yet were infected, we'll kind of get a sense of what percentage of the population is that. That will help us build herd immunity. And then for the folks that may have had just mild symptoms but never went in to be tested because maybe they just had a stuffy nose and they thought it was allergies. Maybe they just had a sore throat for a day or two, and then that went away, and it wasn't even bad enough that they would need a cough drop. So for those folks that may not have had more severe illness that would have caused them to seek medical advice and be diagnosed either with a test or without a test, this will be very helpful, not just for managing now, but in how we address this in the future.
Yes, ma'am. Jerome says, while in Afghanistan, I took the anti-malarial anti-malarial drug that they suggested to battle COVID-19, will that improve my chances against the current strain?
Probably not if you're not currently taking it, but the answer is I don't know. My thought process is that if you're taking that medication, it has a certain half-life, and you have to take it every day in order to maintain adequate levels in your bloodstream in order for it to do its job. Once you get beyond a few days from having taken the medication, you're no longer going to have that same protective effect. And that's going to be challenging moving forward and trying to figure out, does this medication actually help or not? Right now, the best evidence we have says that somewhere between 30 and 40% of people with COVID may be helped by taking hydroxychloroquine. So even if you were taking it, you might be one of the 60% that it didn't help. And because we haven't actually studied it yet, we're not going to know until this is over and we're able to do randomized controlled trials. So that's the best answer I have for right now. Hopefully that's good.
So wait, another question.
Okay. So some of the, let's see, maybe mention them. Yes. So I'm getting a quick prompt just to kind of talk about where we're at right now, both within the Navy and as a nation, as we kind of look at the number of cases. And we don't let our guard down when it seems like maybe we're plateauing, or the number of reported new cases and the reported number of deaths begin to go down. So really what we're looking at are the number of reported new cases. And that is how we're going to flatten the curve, as you keep hearing people talk about on TV, and that's how we're going to know that we've made a difference or we've made a change in how we're addressing the virus. So just because you see things plateauing, that will be a good indicator that all of these things we've been doing at personal sacrifice and national sacrifice are actually working. So to continue the physical distancing until we really know that we're kind of on the tail end, to continue vigorous hand washing and use of hand sanitizer, to continue not touching your face as much as you can prevent yourself from touching your face, and to avoid gatherings of more than 10 people. All those things will need to kind of keep the press on until we begin to see the curve really on the downslope.
Esteban has a question. It says, thank you for doing this. He, along with other sailors in this command, are either taking medications or going through treatment that puts them at higher risk of contracting diseases and viruses. Is there guidance in place that protects sailors undergoing such treatments? If not, are we making headway into placing guidance protecting these sailors?
Thanks for your question, Esteban. So the answer, a quick answer is yes, there is some guidance out there. It mainly pertains to a very concise list for employees that have certain underlying conditions or are on certain medications that put them at risk, such as chemotherapy, such as steroid treatment. All of those things we know can reduce your body's ability to fight off a virus or a bacterial infection. Right now, there's very clear guidance from OPM that is specific for our civilian employees. What our military commanders have done and what I've encouraged them to do is to use the same list for our active duty folks. And thus far, I believe that's what's happening. So if you have a particular diagnosis, some of the more common ones are you have heart disease, and that includes things like congestive heart failure, which you shouldn't be on active duty and have some of these anyway, but I'm just going to go through a few of the things on the list. Age over 60, chronic pulmonary disease, so chronic lung disease. And so there are certain commands that have extended that to consideration for if you're a heavy smoker, you smoke like 2 or 3 packs of cigarettes a day. That kind of gives you a chronic underlying lung disease, especially if you're over the age of 35 and you've been doing this for 20 years, right? If you have previous diagnosis of cancer and it's recent and maybe you're still on some chemotherapy as part of treatment, that would put you in a high-risk category. If you are pregnant, that puts you in what I call a special population category, and I'm encouraging all of those folks to be able to telework when feasible, right? It's challenging because some of us need to be able to get on high side. So at some point you need to pop into the office so you can get on high side, take care of that work, and then transition back to your nipper and do your teleworking. I would encourage you to have that conversation with your command so that they can take care of you, because all of the commanders care very deeply about their people. And I can tell you, I know that because they've been emailing me to make sure that they're doing the right thing for their workforce. That you are our most precious resource, and all of us are doing everything that we can to make sure that we're keeping you safe while we still meet the mission, right? Because we're not bankers. We're not supermarket folks. We wear the cloth of our nation, and we're trusted with keeping our nation safe. And as the Navy, we go forward so the adversary cannot get here. And so, again, very challenging kind of in this time moving forward to make sure that we're keeping the force health foremost in our minds while we're still meeting mission. I hope that answered your question.
Ma'am, Eddie writes, we understand that remote thermometers are going to be shipped to each command in the next few weeks to screen our personnel at the entrance to our buildings.
Yes.
How accurate are these thermometers, and can we get instructions on proper use?
So they're very accurate. They've been tested against the old-fashioned thermometers that you put inside your mouth or under your armpit or in your nether region, right? So they're tested and they're validated. How you can, what was the second part of that question?
How accurate are these thermometers, and how can we get instructions on proper use?
So I think I can give you instructions on proper use right now, but each thermometer will come with instructions. So what you do with the thermometer is you point it at someone's forehead. It has to be the forehead. Don't stick it on the cheek. Don't put it on their bare arm. Don't put it in their ear. But middle of the forehead, as close as you can get, and it's just a very small distance between 3 and 5 centimeters from the forehead. And then basically you squeeze the trigger, and the machine spits out within a second or two, spits out the temperature. And so that is how you use them. But again, each thermometer is going to come with its own set of instructions so that it is, how do we like to say this? Sailor-proof.
Okay, Rebecca asked, since we are now going to be wearing masks throughout the day, how often should we be changing those masks?
So again, if you are in a space or you're in a meeting or you're in a facility, installation, etc., where you cannot maintain 6 feet of distance, that's when you're absolutely required to wear the mask. And what was the second part of that?
How often should we be changing the mask?
So you don't need to change that mask but every day. So if it's a cloth mask, you can wear it throughout the course of the entire day, and then you wash it at the end of the day and put it back on again the next day. In the hospitals right now, because they're running a little bit low on masks, they've instructed, I can speak right now to Naval Medical Center Portsmouth, which is right across the river from me. They have instructed their healthcare personnel to get a mask at the beginning of their shift and wear that mask for pretty much their entire shift, and then dispose of it at the end of the day. That's because they have disposable, not reusable masks. So for those of you who are going to be kind of doing your homemade mask until we get the shipment from U.S. Fleet Forces, those are my recommendations. All right. So when it comes to cloth masks, we've had several different questions about, well, how do we know we're kind of making it right? How do we fashion it from stuff we already have at home? Can I just tie a bandana on, etc.? And so for those of you, I cannot endorse any particular YouTube video, but for those of you that have access to YouTube, there are a lot of videos out right now that provide really great instructions on how you can make a cloth face mask at home with materials that you have on hand. So reusable napkins, cloth napkins, neckerchiefs or handkerchiefs, bandanas, t-shirts, etc. So those are all of the different materials that you can use. If you're going to use cloth, the recommendation is that it be several layers of cloth. So you're going to be folding cloth over on itself to create several different layers. The theory behind that is that the more layers there are, the more layers that virus will have to kind of permeate to get either out from you or into you from somebody that you may pass that's infected. So for those people who think that flannel is a good use, I wouldn't recommend that because it tends to hold moisture, and we all breathe in, well, we don't breathe in, but we breathe out humidified air. That's what our lungs do. And so you don't want that getting wet throughout the course of the day and then maybe trapping the virus. So don't use flannel, but cotton is good.
Yes, ma'am. Felicia says, do you have an estimated time when official face masks will be distributed fleet-wide, what those will look like, and how many will be issued for each sailor's use, disposable or reusable?
Yes. So I believe they're going to be disposable, but don't quote me on that because I don't know exactly what type they're ordering. But Fleet Forces right now is ordering those face masks. They're gathering data from all of the folks that are within their domain, so they know how many to order. And the plan is to order 2 face masks for every every staff member, so active duty, contractor, and GS. That's my understanding as of this morning of what the current plan is. As for a date when the face masks will actually arrive, I cannot even hazard a guess at that because the order is, I believe, going to be placed either today or tomorrow as soon as they gather all of the data so they know what number they're talking about. So just for our domain within I-4, when you do the math, we have approximately 18,000 direct reports to Admiral Brown on any given day. So 2 face masks is going to be somewhere between 36 and 38,000 face masks just for our domain. And Fleet Forces is working on that order for all of the sailors that they're responsible for. I'm pretty sure PAC Fleet is doing the same thing. So just identifying the need and placing the order, I wouldn't want to hazard a guess as to how soon we're going to get them. I know people are going to move heaven and earth to get them to us as quickly as possible, but I wouldn't want to hazard a guess. So I'm just taking a brief pause because right now we don't have any active questions in the comments that are coming through. So if you have any that I haven't addressed yet, please type them in. And while I'm waiting for an audience-generated comment, one of the questions I keep getting asked, and I'm sure a lot of you have been pondering, is how long is this going to last? And how can we figure out an accurate way to kind of predict? And if, why can't we? Why haven't we? And I know you all have been watching the news, and you can't help but seeing some of the predictive models that they've been talking about on the news. What I know and what's been discussed amongst the fleet and force surgeons is that there are a couple of predictive models that are sort of an unofficial go-to. So there's one out of the University of Washington that's generated by IHME, and that is a really interesting predictive model because it looks not only at the prediction of how many hospital beds are going to be needed, but also number of new cases per day, number of people hospitalized, number of people who might need ICU beds, number of people who might need ventilators. But then they're also looking at things that maybe those of us who are on the ground and not medical care about more, such as what schools are closing or are going to be closed. And at this point, it seems like most of them. What social services are being shut down? Which ones are still kind of available? There's another site out of Johns Hopkins that's been quoted and utilized by the CDC, and that one is also very reliable. The interesting thing about predictive models is they are what I would like to call an educated guess. So we take the data that we have available and we do our best job to predict what the future will hold. And that's never 2020, right? It's only when you're looking back that you get that 2020 hindsight. And so all of these models, while doing their best to predict, we're only going to know how accurate they were in hindsight. So you're welcome to get online and do your own research if you like, but those are the ones that I have been sort of looking at.
Ma'am, you're almost right on it. Flossie asked, when do you think the return to standard manning will take place?
That is the question that is on the tip of every commander's mind as we move forward. Because again, as I mentioned, our workforce is our most valuable asset. And we are trying to maximize teleworking right now. I know we're doing that here at Higher Headquarters, and I know all of the other COs are doing their best. And we've had to come up with some really creative solution sets, such as, some people are going to telework here, other people are going to do it the next week, so we have some kind of presence. And what I would say to you is that based on conversations that I've been involved in, that is a topic that the commanders want to get back to as soon as they possibly can for obvious reasons. But they're applying a very cautionary approach, and they're going to be considering very carefully watching when the local numbers in each area begin to plateau and then fall. Because the last thing we want to do is bring people back to work prematurely and potentially cause then another bump in new cases that we might have been able to avoid. So again, I wish I had a crystal ball and I could tell you that it would be 2 weeks or 4 weeks or for sure by a certain date. But I know the commanders are doing their best to get that information out to folks as best they can. And the last thing we want to do is promise people it'll be within X number of days or weeks, and then that's not so, because then you falsely set expectations that you can't meet. So I know that's a really wishy-washy answer, and I wish I could be more firm, but that's as good as I can get for right now.
Mark has a couple questions with a statement in between. He says, what is the current best advice regarding continuing ACE inhibitors for hypertension? I've seen studies saying that there is a correlation with worse COVID-19 outcomes and other studies hypothesizing the exact opposite. What should we be doing?
So as far as certain medications, your statement in the middle is very well said, in that there is a lot of conflicting information about underlying disease processes, medications, etc., regarding COVID. And part of the reason for that is we haven't had the opportunity to study this in depth yet because it's only really been on the scene for a few short months. It was in December that we began to recognize this was like a real issue in China. And it wasn't until weeks later that we began to recognize, oh, wow, this is a thing, and it's a thing here, and we need to start worrying about it. So the ACE inhibitor, what I would say is have a conversation with your physician. For sure, don't stop taking any medication without making sure your doctor can either give you an alternative or figure out how to treat your underlying disease process with something similar, which I guess is the same thing as an alternative. So to answer that question, I would stay on the medication that you're on right now, and if you see something that's reported in the news, talk to your doctor or your healthcare provider to find out whether that's really a thing or it's just some item that's being reported. I got to tell you, I've been watching the news not as much as some of the rest of you have, and I've been trying to modulate because it's a little overwhelming right now. You can't turn on any channel without seeing COVID-19, and it's like 24/7 on some news channels. But there's a lot of information that's being put out there without it being vetted through the scientific community or without it being actually studied. And so that is causing a lot of uncertainty for folks because you want to believe what you see is the truth, and yet there's a lot of discussion, even within the medical community, about how to best approach certain medications. Someone brought up earlier the chloroquine, shouldn't we be just giving that to everybody that's COVID positive? Well, maybe not. And this is, again, now you've stumbled onto what we call the art of medicine. Sometimes you don't know all that you wish you did when you're trying to take really great care of people.
Ma'am, Jackie says, is it a good thing for COVID survivors to be blood donors, and is Naval Center Portsmouth taking that type of blood donation?
So I don't know right now whether Naval Medical Center Portsmouth is taking that type of blood donation. I will get back to you on that. Bear with me for just a minute. I'm going to take a quick note so I don't forget, because I can guarantee if I don't write it down. So blood donation at NMCP for COVID-19 post. Okay. But the answer to the first part of your question is yes, there are actually multiple centers who are asking for the donation of blood specifically from people that have already had COVID so that they can use that blood and the antibodies that have been generated in that blood to treat some of our more sick patients out in the civilian community. So like I said, I will find out as best I can from the military side of the house for Portsmouth specifically. And then I would encourage you folks can probably get some of this information online as to where there are local facilities, wherever you're stationed in the world, that might be actively seeking a blood donation so they can use the plasma from post-COVID folks. Thank you. That was a great question that gave me the opportunity to put some information out that I otherwise wouldn't have thought to talk about today. So thank you, Jackie.
A question that we have is, there's different types of masks out there, including homemade ones and then just told to cover your face with something. Is one better than the other, and is just covering your face with something of any benefit?
So, yes, the thought process is now that there are some folks out there that are asymptomatic shedders, and you may be one and not even know it. So the recommendation is that if you're going to go out in public and you can't keep that 6 feet of distance, that yes, you should have a mask on so that you're protecting not only yourself, but you're protecting maybe that other person from you who may not even know you are shedding virus. As to the quality of material, at this point, I think that the most important thing is just having that barrier up to protect and to cover your nose and your mouth. Those are the two entry portals from a respiratory standpoint. And so surgical masks, N95 masks, Cloth masks, I think all of those are fair game at this point. And again, for a lot of us, it's going to be really challenging to get those surgical grade masks or N95 right now. And I can tell you that at least from a higher headquarters standpoint, we have placed orders that have been canceled because the vendors have made it very clear their priority right now for supply chain access and for delivery of goods, for thermometers, for personal protective equipment, is first responders and hospital staff. And so it's going to be challenging for people. You can't just walk into Walgreens anymore and buy yourself a box of surgical masks, right? And so with that in mind, the CDC and the DoD, per the most recent NAV admin, which I think was 100/20, made it very clear you can fashion from cloth a face mask for yourself if you cannot get or do not have access to a surgical grade or N95 mask. Did that answer that question?
I think so.
Okay, awesome.
And there's a follow-up to the blood donation question. Selby says, I know with the Red Cross you have to have a confirmed positive test and then a follow-on confirmed negative test to donate plasma. But many of us didn't get tests to confirm.
And that's going to be a challenge, right? Especially because there's a lot of folks where they either didn't have enough tests, which was true until very recently, and even in some areas, there's an inability to test every single person that they have a clinical suspicion for, not just because they don't have enough tests, which is less of a thing now than it probably was a week or two ago, but also because the labs can only process so many labs per day, so many test kits per day, rather. And so that's going to be a challenge moving forward. So for those of you who did get tested positive and now have confirmed negative testing, you are the group of people that they are looking for plasma for. Hopefully, as time goes on and we have more people that actually have received a test that was positive and then had to have those 2 subsequent negative tests, will grow the number of people who will be able to donate. So thank you very much for bringing that up. Okay. So we're just going to take another pause, and if you have any questions that you feel like I haven't addressed thus far, please go ahead and type them in. You'll be happy to know that even though I am not wearing a face mask right now, we are at headquarters maintaining a good 6 feet of distance between the folks who are reading the comments or making sure that I see the questions and our audio-visual expert. So trying to set that good example.
Oh, here we go. Shamika asks, can you use the sanitized setting on your dryer for surgical masks to be able to be reused?
I don't see why not. The bottom line is it's going to be a couple of different issues. It's going to be the mechanism of the washing machine itself and the detergent that's in the washing machine, and then that sanitizer setting on the dryer. I don't have personal knowledge of exactly the temperature that goes to and why they've been approved to say it's a sanitizing temperature. So I hesitate to give you false assurance that that level of heat is exactly what's needed to kill all viruses and bacteria, but I will get back to you on that as well. You guys are giving me some homework to do, right? Okay. I'm not all about just talking to fill space. I'm trying to think of any other topics that haven't been covered already or that I might have included in.
COVID-19 affecting unborn child?
That is a great question. So for those of you who didn't hear that, that was our audiovisual guy extraordinaire, Bob, who said, hey, maybe somebody wants to know whether or not COVID-19 can affect your baby if you're pregnant right now. So there's, as you might imagine, since we only have a few months of data right now, we don't have a whole lot of information regarding pregnancy and COVID. But based on the study, and I shouldn't say the studies, the case studies and this case series that have come out of China and that we're beginning to look at here in the United States, and I think there's been a little bit of information coming out of France as well. They have taken women who they knew were positive for COVID and then tested their babies at the time of delivery. And those babies, all of them, again, it's a small number, but all of those babies tested negative. That's really great information because what it does is it confirms that what we know about many other viruses, including the flu, is that it isn't vertically transmitted. And what vertical transmission means is that when you are pregnant, what you have can be transmitted through your uteroplacental blood flow to your unborn baby. So that's all very reassuring news. Anytime a woman gets a severe respiratory illness in pregnancy, we know that she's at an increased risk to develop complications because during pregnancy, a woman has a relatively immunocompromised status compared to when she's not pregnant. But what we noted in a group of 18 women who tested positive for COVID, that of all of those 18 women, only one of them ended up in a ventilator, in an ICU bed rather, on a ventilator. That actually is a lower percentage than the overall ventilator risk for the underlying COVID population based on numbers that we know right now. So while not 100% reassuring, it is somewhat reassuring. And again, we don't have a lot of information right now. So because of that, what we're doing is waiting on guidance. It's not official right now, but the DoD is working hard on putting together guidance that is very specific to our pregnant population. So as soon as I have that guidance, I will be more than happy to pass it out to you.
Yes, ma'am. Taylor has one. It says, with the concern of too much contact.
Hold on a minute, Tyler. We're going to answer your question.
Okay. It says, with the concern of too much contact between people and the need to wear masks, there are still hand-to-hand combat classes such as VBSS still going on where the individuals are in extreme close contact and many times the masks fall off during these training scenarios. Is there a way forward with these classes or a better way to protect sailors?
Tyler, can you do me a favor and can you tell me what VBSS stands for? I'm not familiar with that acronym.
Visit Board Search and Seizure.
Visit Board Search and Seizure. So that's Coast Guard / Navy. Okay, I got you. So I was unaware that those were still ongoing. I will look into that and see, what the recommendations are going to be going forward. And I'll be honest with you, I'm sort of surprised to hear that those kind of close contact classes are going on, because if you've been following what's been going on both in the news and with the Navy reporting, boot camp has been shut down completely for the next couple of weeks. The Army has shut down basic training for the next couple of weeks, so they can kind of get a handle on when is it safe to again have people in those close, kind of a contact situations where they may not be physically touching each other, but they certainly are living in big open bays. And so I know that there's been a real careful look taken at all of the things that we can not do right now, at least temporarily, to help protect our sailors, soldiers, airmen, Marines, and coasties. So thank you very much for bringing that to my attention. I will look into that and try to figure out how we can fix that or address it.
Okay. Bob says, what advice do you have for employees with a newborn at home? Should they be advised to remain on telework exclusively? That's a tricky
one, right? So a lot of this gets into immunities, breastfeeding versus bottle feeding, and all of that. I would say talk to your pediatrician, find out what their concerns are for the baby, because the baby's immune system, you're right, is not robust at all just yet. That's going to take a while. Breast milk helps. So this is my opportunity to plug breastfeeding, but every woman can't breastfeed, and so there's a lot of bottle-fed babies out there, right? And so I would make sure you address that with your pediatrician, but for right now, that has not been a consideration for allowing folks to telework or mandating or encouraging telework. I will tell you right now at higher headquarters, we only have, I want to say, between 30 and 35% of the workforce in the building at any one given time. We have maximized telework, and I know that all of you are probably in the same situation. I would bring that concern to your leadership first as a parallel to talking to your pediatrician to see what their level of concern is. But I wouldn't necessarily recommend right off the bat that you automatically have to stay home and telework. What I would say is to be extra careful about hand washing before you touch the baby. Touching your face touching your surfaces, then touching your baby. So I know we're all kind of hyper vigilant right now about all this hand washing, but especially if you have a baby in the home, hyper vigilant would be my recommendations as well.
Raphael asks two questions. What is the threshold number we are looking at to say that it is safe to return to work? And also, how long post the pandemic can we see the virus has been eradicated enough to deem our nation safe to return to normal again? I don't believe that 0 infected is a realistic number.
So the answer to your first question is going to be squishy because you want a hard and fast number about like, and I might be reverse engineering your question, but are you asking the number of people that have already been infected and are now recovered, or just the number of people that we say have been sick? And I mean, I could answer that question from a bunch of different kind of standpoints. So what I'm going to say is returning to work is both an individual and then a national issue, right? So there are the return to work guidelines for folks that are either just SIQ because they have influenza-like illness, and then there are the guidelines for folks who are PUIs that have been tested and not been tested. And then there's the much larger, both from a Navy total force standpoint and from a national let's get back to work and get our economy going again standpoint, right? I hope I'm interpreting that correctly. So what we're waiting for is, and it's not necessarily going to be X number, it's going to be watching the trajectory of the newly reported cases curve. So as the newly reported cases are accelerating, and we think based on what we know about the predictive modeling that this week may be a week that is accelerating faster than the weeks previously. And then once that acceleration peaks and plateaus and begins to move in a diminishing range, that discussion will be held by national leaders and Navy leaders so that they're figuring out how they're going to mitigate and balance risk to force, risk to mission against the number of cases that are being reported and that we know are out there. So I know that wasn't a hard and fast answer to your question, but unfortunately there are so many variables in how that question is eventually going to be answered that I'm not going to put my neck out and say, oh, it's X number of people, because I just don't know. I don't think anybody knows right now. It's more of a confluence of multiple different variables as we move forward.
Raphael had written back and said yes, the latter to what you were saying.
So did I answer it?
To the question.
What was the latter? Remind me, because it's been a while. I was talking for a minute or two.
I'll go back and reply to him.
Okay.
Charlene says, is it true that the virus can't live in hot temperatures, 85 degrees plus? Can we expect the summer temperatures will help?
So no, not 85 degrees or more, because your body is 98.6 and it's happy as a little clam living in there, right? So it's, again, I'm going to have to get back to you all on the exact temperature that it would take to kill the virus. Because one of the other questions I had at some point was, well, why don't we just send everybody home, raise the temperature in all of the facilities, kill the virus, and then have everyone come back to work? So that's not really a viable answer, in as much as it's not going to be possible to raise the temps that much. But your observation that summertime will help is very valid, and the reason is not heat, it's UV light. And so what happens in the wintertime is there's less daylight, less UV light, and depending on where you're at in the world, you may only have an hour or two of sunlight per day. In addition to that, you have everybody clustered inside in most climates, not the warm ones, but in the colder climates. And so that allows the virus opportunity to replicate and be transmitted from host to host much more rapidly because everyone's inside. What happens with spring and summer when the temperature is warmer outside is people go outside more often. They're less likely to stay indoors, and the UV light from the sun helps to kill the virus. So that's why summertime is going to be important, but not necessarily from a heat standpoint.
Regina asks, what is the guidance or threshold for reporting presumptive positive cases, particularly when testing has not been done and therefore there is no official diagnosis?
So the reporting requirements are if you have symptoms, right? So you got to have cough, shortness of breath, achy feeling, we call that myalgias, fatigue, a fever, right, over 100, technically 100.4 degrees, but for screening purposes over 100 degrees. If you have symptoms and you meet risk factor criteria, so you have traveled to a high-risk country, you have had close, prolonged contact with a known COVID positive patient, would be 2 of the current risk criteria. Then you are a person under investigation. Once you are a person under investigation, you fall into one of 2 categories. You are either a person under investigation who's been tested and we're awaiting your test, or you're a person under investigation that does not get a formal diagnostic test. And part of the reason we decided to adopt that criteria were multifactorial. Number one, when this first started, and even now, there are still some areas that don't have tests, or they have a limited number of tests. And so they're trying to use those for folks that they feel it's more clinically necessary or critical to get those tests done in. And so because there's been such vigorous community spread at this point, if you meet those criteria, then you are just given the presumptive diagnosis. I know it's kind of confusing, right? Because you're like, well, how do they get the diagnosis if they never even had the test? And the reason we're doing that is because we have a reasonable clinical suspicion based on your history and the fact that you have symptoms. So in this particular situation, that is why the decision was made to do both of those categories of folks. So the trick then is, from a return to work standpoint, the rules are a little bit different. So if you had an FDA-approved test, you must fall into several categories before you can go back to work. You got to have resolution of your fever for at least 3 days without using any anti-fever medications. You have to have improvement of your respiratory symptoms. So if you had a cough or shortness of breath, that's got to be getting better. And then you also must have 2 negative COVID-19 tests that have been done at least 2 days apart, or at least 24 hours apart, excuse me. If you never had a test, then the criteria for going back to work are very similar, except the fever, no more. It has to be at least 3 days since you had your last fever. It has to be at least 7 days since the onset of your symptoms. You have to have improvement in your respiratory symptoms, and then you can go back to work, right? So if you never had a test to begin with, you don't need a negative test to go back to work. And I realize that also is a little confusing for folks. But for right now, based on the best medical knowledge that we have, we've determined that then you are safe to go back to work and not be as infectious and not be unsafe for your colleagues.
Yes, ma'am. Raphael wrote back, said you answered this question. Thank you. His question was, you answered at the micro level, the general population that was not sick, just not working for precautionary reasons.
Okay.
Madeline asks, most of us rewear our uniforms for a couple of days. If I put my uniform in the dryer, does that help kill anything that may be on its surface?
And again, I don't know how hot the dryer gets, and so I hesitate to say absolutely or absolutely not. But that is one of my homeworks that I have for action, and so I will be taking that and finding out, and then I can let you all know for sure one way or the other. I feel pretty confident that if you are washing your uniforms and drying them, that you're doing the best you can to clean as much of that uniform as you can. But from a temperature alone standpoint, I don't want to say for sure because I just don't know. So I will find that out for you. Sorry about that. Okay. Oh, perfect. So PAO is just reminding me to let everybody know that for the homework that you all have generated for me, I will be posting the answers on this Facebook thread. So you'll be able to access my answers, and hopefully I'll have them within a day or two. I can't imagine that it would take me longer. So as soon as I have those answers, I will get them posted on this thread for you all so that you can see as a group.
Shamika wrote, says, I have read that facial steaming for at least 15 to 20 minutes will kill the virus. Is this true?
You guys are hitting me with some really great temperature-related questions right now. I would say I don't know. I can definitely find out. Facial steaming is challenging because we know that the virus can live and does, and that's why we do nasal pharyngeal swabs. It lives in your nose, right? It lives in your pharynx as it kind of gains entry into your body. And so that's a great question, and I have another due out. I will make sure I get back to you on facial steaming. I can tell you there's been no study looking at that, so it's going to be anecdotal evidence. but I will do my best to get you that answer. And can I just put a caveat out there? For those people who have never done facial steaming before, please be careful because you can burn yourself if you get your face too close to the pot of water or the steam emitting device, because that's, as it turns out, really hot and it can burn you. So please be careful if you're going to start doing that.
Antonio says, should you wear a face mask when exercising outside?
If you are going to be running with somebody or golfing with somebody or fill in the blank for your favorite exercise du jour, if you are not going to be able to maintain 6 feet of distance between that individual for that prolonged period of time that you will be exercising, yes, you should have a mask on. If you're going to be out running or if you are bicycling and you're not in a situation where you're that close to the person in front of or beside you, then you do not need to wear a mask. Again, mask wearing is for when you're going to have prolonged contact, close contact with folks in a social setting that you cannot maintain that 6 feet of distance from. Hopefully that answers your question. I know it's been kind of confusing because the guidance for wearing a face mask has changed. It seems like it's even changed in just the last few days based on what you can and can't or what you are and are not recommended to wear. Okay. So we're kind of winding down. I just wanted to let you all know we have about 4 more minutes that I'll be on live stream with you all today. I will be providing the opportunity for us to interact again sometime within the next, excuse me, sometime probably within the next week. I just have to find, make sure my resources are available. I will shift the time frame. We'll do that in the evening hours. So for those folks who are unable to get onto Facebook because they were either in the workspace and either didn't have the time or couldn't access Facebook for whatever network reasons, they should be able to access in the evening. And so I'm going to aim for sometime 6 or 7 o'clock-ish in the evening. And so more to follow on that. We'll probably post that information in this forum as well as on the I4 portal, and I'll also be sending an email out to all of the triads to make sure that they can push it out to all of their folks as well. But we have a few more minutes for anybody that has last-minute questions or concerns to kind of punch in.
We have received some thank yous though. Madeline says, great job, Doc. And then Shelby says, thank you again for your time. Jenny says, thank you.
Thank you guys so much for tuning in and for bringing your questions up, because I can guarantee you that for every question you all ask, there's probably another 50 people that have the same question. And so I know especially for a couple of them regarding the blood donation and the temperature questions regarding steaming and dryer settings, I'm sure other folks have those questions as well, because there's a lot of information out there on the internet right now, and some of it's accurate and some of it's not. So,
All right, so it looks like our last question,
Okay.
As Antonio says, do you have any recommendations to assist in strengthening your immune system?
yes. So the most important things you can do for your immune system are adequate nutrition and hydration and exercise, because that's what keeps your homeostatic self humming, right? So adequate vitamins, minerals, dietary intake, that's probably those. And if I forgot to mention it, sleep. You all need to be getting enough sleep, right? Do not stay up all night binging because, you don't have to get up right away as early as you used to anymore. So sleep and adequate nutrition are the 2 most important things you can do to maintain your health, build your immune system, and hopefully prevent yourself from becoming ill.
And Raphael said thank you, and Alice said thank you, lots of good information. So,
Excellent. So as we wind down, I'm at the T-1 minute at this point. So I would just like to say thank you to everybody one more time. I appreciated the opportunity to be able to reach out and connect with you. Even though I couldn't see any of you, I really appreciate all the questions and the thoughtfulness and the feedback when I didn't understand what certain things actually meant. So thank you so much. Thank you for doing what you do every day, whether you are on active duty, you're a civilian, you're a contractor, you're a family member. We're all in this fight together. we still have a ways to go before this is over, and please reach out to me with any questions or concerns as we move forward, and the information seems to continue to morph and to change the way that we do business and live our personal lives. Thank you so much. I'm going to go ahead and sign out now. Have a fantastic day.